but it was otherwise you had this dream about this wonderful agent that worked and had this profile and then woke up and it's gone. How disappointed would you be that if such an agent didn't exist? On a scale from 0 to 10, where 10 is incredibly disappointed and 0 is not disappointed at all.
I could probably say, a 7 probably, because we always have to have, stuff on the back of our pocket, right, for those kids, because it's a chronic disease. So it's a different things of if you're asking me upfront, right? Because we know we'll have to treat those kids, unless it's a game changer, and again, this is a one treatment, 24 months, and this is it. But when, like I said initially, when we have those low-grade kids, we know that we will probably have to treat them several times. So having option there with, again, low toxicity profile and effective until the tumor burns out, which we think, happen when they're usually in the second, decade. That's actually cool, right? And then you can discuss with parents. You can offer option based on the efficacy toxicity profile. So yeah, probably 7.
Got it. Okay, 7.
Again, you didn't give me the percentage of response rate and then toxicity, right? So I can't really, but
we didn't. And I guess I'll ask you the question. Maybe the way I had set this up was to turn it the other way around. To be competitive or to be minimally acceptable, what would the percentage of adverse grade 3, 8, 4 adverse events need to look like? For example, what are you experiencing with the MEK and BRAF inhibitors now?
So rate of toxicity, it's more the type of toxicity.
Okay.
Because again, like if you're giving me a drug that has a 5% of grade 4 neutropenia or grade 3, 4 fever neutropenia, that's not really exciting in a way of you're still going to take a risk of having your kids admitted for fever and neutropenia for a benign tumor, right? So there's something about sure, the percentage, like if you're saying 20% risk of fever neutropenia, well, it's actually not the greatest for quality of life. So it's not necessarily severity. It's and then again, like if you're giving me a 10% risk of cardiac toxicity long term on a kid that has a benign tumor, do I really want to make him cardiac insufficient when he's 20? Just because in 10% of the case, I don't know, right? He's not going to die of his disease. So I think the difference with a malignant tumor is that it's either you die of your disease or you accept some toxicity. This one for me is a bit more. You just have to be careful in what you're willing to accept for that chronic time that they're getting treated.
Yeah, no,
so the typical example is the vinblastine, for instance. Like you give that chemo once a week, very little neutropenia, barely no admission for complication. And then the kids continue to go to school. They don't lose their hair. Their energy level is pretty good, except for teenagers. So it's okay to treat them for a year and a half with that, because I'm not taking away a year and a half of their life. So there's the long-term.
Yeah. So the chemos have a relatively.
Hey, honey, can you give me 10 more minutes?
I'm sorry? Oh, sorry.
Sorry. I was just getting your phone call. Sorry.
No worry. We're just about done here. Dr. Benner asked if any of my colleagues on the phone have any questions. To feel free and weigh in.
I'm not sure I completely responded to, the dream medication and what's acceptable. There's certainly, percentage. It depends on what you're giving me in terms of a type of toxicity, right? So something are going to be long-term or impairing their day-to-day quality of life, I'd be looking at differently. So I can tell you for the MEK, we can manage the skin toxicity, but it is to some for some patient a real burden for day to day. They can't walk. They spend their time on antibiotics. Soaking their feet. They can't go to school. They can't fit their shoes. So
Got it. Sorry, did one of my colleagues have a question?
Yes, thank you, Doctor, for all of your comments. This has been very informative. I just had 2 quick questions, I think, just about the pharmaceutical companies and